afternoon. I'm Heidi Holste, Director of Government Affairs here at Care Providers in Minnesota, and this is your Inside Scoop. This week we held our second march at the Capitol for our members to come in and visit with legislators. We had really successful 2 days. Last week we had one, and again this week we had one. Combined for the 2 days, we had 98 attendees who visited over 68 lawmakers, and I started to say over 68 because the number 68 was the number of meetings we actually had, but we also stopped lawmakers in their offices and in the hallways and talked to them as well. So thank you very much for coming, and we'll do it again just the same way last year. Please let us know how your meetings with your legislators went and if there's any feedback or anybody that we do need to follow up with. So moving on to other issues this week. It's second deadline week. That means that any bill that will progress this session has to have had a hearing in both the House of Representatives and in the Minnesota State Senate. So it's been a really, really busy week. And additionally this week, the House and Senate released their targets. Targets means how much money they have identified that they are going to raise and how much money they are going to spend or how much money they are going to cut. And in the Health and Human Services arena, they were given a cut target. The Health and Human Services Committee in the House is on schedule to cut $150 million out of the Health and Human Services budget. And in the Senate, they are going to cut almost $153 million out of the Senate Health and Human Services budget. We're disappointed by that news. There are going to be some taxes increase this session. We've been told by leadership in the House and in the Senate, as well as some committee chairs, we've been given assurances that they would like to provide rate increases for long-term care. And as you know, we have a 5% rate increase bill in. We've been told that they'd like to be able to do that, but what we're trying to figure out is where we fit within that $150 million cut target. So we ask that you contact your legislators. Next Wednesday, or I guess this Friday, legislators go on Easter Passover break. We're asking that you talk to your legislators. We're calling next Wednesday, March 27th, Senior Day in Minnesota. We ask that you ask them to come in and take a tour. If they're not available that day, then ask them to come on another day when they are available. We have information posted on our website about, it's just one link you can link to, and it provides you additional information about handouts and how to conduct a tour with your legislator and what to ask of them. And essentially what you want to ask of them is, please provide a 5% rate increase for long-term care providers. And then tell them the story about why you and your staff and your caregivers need that money. So that's where we are on that. We've also had some other bills going through the session, including background studies, survivability of actions after the death or disability of a person. We're trying to influence that legislation. We have the Governor's Department of Human Services Continuing Care Bill, requiring employers to allow employees to use sick leave to care for a family member. There are bills that would change how long an assessment is valid, an assessment completed by the county, and changes to the disability rate system. There's also been hearings on the minimum wage. We've definitely let lawmakers know that we'd like to pay our staff more, but please have an appropriate increase in the minimum wage. And then there's also a nurse staffing ratio bill. The Hospital Association, or the Nurses Association of Minnesota, had introduced some legislation that we require certain ratios for RNs at hospitals, and we talked to lawmakers and said that actually might have a negative impact on nursing homes. We have a hard time recruiting registered nurses for nursing homes. So the bill is now turned into a study. So that's what's happening at the Capitol this week. As I said, next week is Easter and Passover break. Please invite your legislators to come in for a tour. At a minimum, contact their offices and let them know that you support a rate increase, because if they don't hear from you, then they won't know it's an issue for long-term care. So thank you for listening today, and we will talk with you again next week.